Cisplatin is a medication used to treat different types of cancer. It is a chemotherapy drug that contains platinum, and it works by slowing or stopping the growth of cancer cells. This medication is typically given through a vein by a healthcare professional. The dosage and timing of cisplatin will depend on the type of cancer being treated and the individual's specific condition. It is important to follow the instructions provided by your healthcare provider for the best results. When using Cisplatin Vial, the medication is typically administered through a vein by a healthcare professional. The dosage will depend on your medical condition, body size, and how you respond to the treatment. It's important to increase your fluid intake and urinate regularly while using this medication to prevent kidney side effects. Your doctor will advise you on how much fluid to drink, and it's important to follow their instructions closely. If the medication comes into contact with your skin, be sure to wash the area thoroughly with soap and water. Side effects may include loss of taste, diarrhea, nausea, vomiting, or loss of appetite. Your doctor may prescribe medication to prevent or relieve nausea and vomiting. Eating several small meals, not eating before treatment, or limiting activity may help lessen some of these effects. Temporary hair loss may occur, but normal hair growth should return after treatment has ended. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you experienced serious side effects, such as pain/burning/redness at the injection site, muscle cramps/spasms/weakness, ringing in the ears, hearing loss, joint pain, mental/mood changes, such as confusion, headache, blood in urine, painful/difficult urination, or lower back/side pain. Vision changes may occur with cisplatin use, but normal vision usually returns after the end of treatment. Get medical help right away if you experience very serious side effects, such as chest pain, pain/redness/swelling of arms or legs, or seizures. Rarely, this medication may increase the risk of getting other cancers, so it's important to consult your doctor for more details. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Cisplatin can have some serious side effects like kidney problems, nerve problems, and severe nausea and vomiting. You may also experience a decrease in bone marrow function, which can lead to a low number of blood cells. This can cause symptoms like anemia, decreased ability to fight infections, and easy bruising or bleeding. If you notice any changes in the amount of urine, numbness or tingling in your arms or legs, loss of reflexes or balance, trouble walking, nausea, vomiting, unusual tiredness, pale skin, easy bruising or bleeding, or signs of infection like a persistent sore throat, fever, or chills, be sure to contact your doctor right away. Remember, it's important to take this medication exactly as directed by your doctor to get the most benefit and to minimize the risk of side effects. Before using cisplatin, make sure to inform your doctor about any allergies you may have. Also, let them know about your medical history, especially if you have kidney disease, blood disorders, hearing problems, mineral imbalances, numbness or tingling in your arms or legs, kidney stones, or gout. It's important to avoid immunizations and contact with people who have recently received oral polio vaccine while using this medication. Be cautious with sharp objects and avoid activities that may cause cuts, bruises, or injuries. Wash your hands well to prevent the spread of infections. Older adults and children may be more sensitive to the side effects of this drug, so extra caution is necessary. Cisplatin can also affect fertility in both males and females, so it's important to discuss this with your doctor. If you are pregnant or plan to become pregnant, talk to your doctor. It's important to avoid pregnancy while using cisplatin, as it may harm an unborn baby. Reliable forms of birth control should be used during treatment and for a certain period after the last dose. For those who are breastfeeding, it's not recommended to use this drug, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Cisplatin Vial, as they can affect how this medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare provider. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cisplatin Vial include aminoglycoside antibiotics, such as gentamicin, neomycin, amphotericin B, anti-seizure medications, such as phenytoin, and certain water pills, like furosemide and bumetanide. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much cisplatin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center for assistance. It is important to undergo lab and medical tests while using Cisplatin Vial, such as kidney and liver function tests, complete blood count, blood mineral level tests, and hearing tests. Make sure to attend all medical and lab appointments and consult your doctor for more details on these tests. Make sure to take each dose of Cisplatin Vial as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. Be sure to follow the storage instructions provided with the product and ask your pharmacist for any additional details. It's important to keep all medications out of reach of children and pets. Make sure not to dispose of this product by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. If you have any questions about the disposal process, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.